afternoon, everyone, and thank you for joining us for part 3 of our 3-part assessment webinar series. We'll be getting started in just a minute. We'll try to keep it promptly starting at noon. Thanks. Hi, everyone, and welcome to E-QIP's Sustainability Assessment webinar. We'll get started right away, and hopefully we'll have you all wrapped up shortly after 1 o'clock. We have scheduled till 1:15, but we'll try to get you out of here a little bit before that. So just to start with a couple of housekeeping items, we are using the GoToWebinar platform today. Audio is available through your phone and your computer. If you look in the bubble on the right-hand side, it does have the information for the telephone audio. You can call in toll-free and just add the access code there. You can also send us a message in the chat or question box. We'll have a couple of built-in breaks for questions specifically, but if you think of anything before those times, just again, feel free to pop it into the chat or question box, and we'll get to those as soon as we can. We've also uploaded the PDF version of the slides, and you can download those at your leisure. And there's also a copy of the integrated assessment in an Excel spreadsheet that you can download as well. And throughout the webinar or anytime really, please feel free to tweet to us using the hashtag E-QIPON or E-QIPON. We have a pretty good social media presence, I like to think, and we're happy to interact with those who have worked with us before or those who are interested in all things quality improvement and data and measurement. So just a couple of quick objectives for today's time together. We're hoping to compare and contrast quality improvement and quality assurance to set some context for the session. We're going to introduce E-QIP's integrated assessment tool. We're also going to take the opportunity to define sustainability and share the sustainability self-assessment for agencies, describe how a sustainability assessment can be used to inform quality improvement work, and then share some additional resources at the end that can help advance your agency's QI readiness and sustained improvement. So my name's Alex Clement. I'm a quality improvement coach with the Excellence Through Quality Improvement program, better known as E-QIP. And I'll also be joined today with my colleague who is also a quality improvement coach, Laura Daly-Trottier. And we are based in the northeast of the province, and we're happy to have you join us today. So the Excellence Through Quality Improvement project, better known as E-QIP, some of you may be familiar, but for those that are just new to this, it is a joint partnership that is led by Addictions and Mental Health Ontario, otherwise known as AMHO, and the Canadian Mental Health Association Ontario Division. And we're joined in close partnership with Health Quality Ontario, soon to be Ontario Health, as well as the Provincial System Support Program, PSSP, at CAMH. And E-QIP was really born out of a need that was identified in the mental health and addiction sectors for quality improvement, education and leadership, as well as capacity building. So you can see at the bottom of the screen some of the main aims of the Excellence Through Quality Improvement project. And our hope is really to support agencies to achieve a vision of using evidence-based assessment tools and quality improvement to improve mental health and addiction care in the community. And we hope to do that through increasing the understanding and use of quality improvement methodologies, increasing data literacy, working towards improvement in key domains of quality, spreading promising practice, as well as supporting a culture of quality improvement learning and mentorship across the province. We hope to achieve these aims through using 3 frameworks. Again, some of you may be familiar with these. The model for improvement on the left-hand side is really the framework that we use when we work with our project teams. This model is guided by 3 questions and a cycle, otherwise known as the PDSA cycle. And really, this is how we hope to increase quality in the domains of quality that you can see in the center of the screen. And those are safe, client-centered, timely, efficient, equitable, and effective. So again, really increasing the quality of these domains, especially from the client perspective and keeping them at the heart of things. And we hope to do this in order to achieve the quadruple aim across the province. And the quadruple aim looks to improve patient outcomes across the province, improve patient experience or client, depending on the sector that you're in, lower cost of care, but also improve provider experience. And provider could be the frontline staff, the volunteers, the other service providers across the sectors as well. So you may be asking, what does sustainability have to do with my work? And well, to answer that question, we've got to go back a little bit of a step further and kind of set the context for QI, or quality improvement in data, in our sector as it is. For many of you, you're probably aware that we're undergoing some pretty transformational times within the sector with the creation of Ontario Health and the direction towards Ontario Health Teams. And for those Ontario Health Teams, there's really been 8 pillars that have been identified as sort of the benchmarks that we'll use to measure success in these areas. One of them, of course, being on the top right-hand side, performance measurement, quality improvement, and continuous learning. So on that note, you may be wondering, what exactly is quality improvement? And that's really the systematic approach to making changes that lead to better client outcomes and a stronger system performance and enhanced professional development. So it's really that journey from good, better to best, again, in a continuous manner that's kind of at the forefront of all that we do. It is critical that we draw on the combined experience and efforts of all of our stakeholders, including the clients that receive the care, the service providers that are providing the care, as well as all others that kind of touch the aspects of this system, including researchers, planners, policy writers, the families that are involved, of course, with our clients and our other system partners. And the goal is to really make those better improvements, as well as make sure that they're sustained for a long time, because we don't really want the hard work that we've done to sort of dissipate after a while. Once we see those gains, we really want to keep them. And to kind of contrast quality control and quality improvement, and sometimes quality control might also be referred to as quality assurance, we've got a little bit of a table here to sort of contrast and compare those two. So of course, quality assurance, quality control, which many are familiar with in terms of things like accreditation, audits, making sure that a minimum standard is being met. So really about that compliance, where quality improvement is, again, continuously improving processes to meet standards. So those quality assurance / control and quality improvement are related. They are quite separate. Quality control can be a source of quality improvement work. So for instance, under the means row, we see that quality control is really about inspection. So if we're inspecting and we see that there's an area where we can improve, that's when we want to put our QI lens on and start working in sort of a systematic way to make those improvements. We also see differences across attitude, focus, scope, and responsibility. And again, I just want to sort of highlight the bottom row there being responsibility, where quality assurance and quality control is really the responsibility of a few. Quality improvement is the responsibility of all. So that's everyone that touches the system, the process, or the program. So with performance measurement that was mentioned earlier when we were talking about those sort of building blocks of Ontario Health teams and quality improvement, again, these are kind of two related but distinct concepts where performance measurement and performance monitoring really is used to identify gaps between current and desired performance, which can again become a focus for QI work. So once we're doing things like quality control and we're seeing, oh, you know what, the standard we want to be at is X, but we're falling a little short, maybe this is an opportunity for us to do some quality improvement work. It also talks about benchmarking, which is sort of taking performance standards that exist or have been determined elsewhere, or the achievements that you're seeing at other high-performing organizations or systems to help establish performance targets and to see where the opportunity is for that potential improvement. It provides an opportunity to quantify and to measure, again, that gap between sort of the current and the desired performance. So ongoing performance measurement tracks the impact of quality improvement initiatives overall. And on that note, I'll pass it over to my colleague, Laura.
Thanks, Alex. Good morning, everybody. Actually, it is afternoon. We talked about, in the other two webinars, we've talked about the QI readiness assessment and the data quality assessment, or data culture assessment. And this webinar, we're talking about the sustainability. And really the question is, that you're asking yourself is, what is it that we're looking for in our current system that we need to pay attention to, and that will actually increase the likelihood of sustained gains. Next slide, please. And so when in quality improvement, there's a reference here stating that it often takes longer than expected to take hold and longer still to become widely and firmly established within an organization. And this is very true in the work that we're doing currently. That does take time to determine what changes that you can make will actually impact the outcome long term. And what we are noticing and have seen is that some of the changes that we're putting into place actually fail to survive the long haul. So it's important to have conversations and have an understanding and clarity about what sustainability means to each improvement initiative, not necessarily the overarching thoughts around organizational sustainability, but specific to each improvement project. And so keeping a close eye on these things as you move through your improvement initiative will help you determine what you need to do in order to put those things in place that will allow you to have that success. So the NHS developed a model integrating 3 high-level factors that play a very important role in sustaining change. Next slide, please. And we're going to be talking about that and over the next few slides and giving you some kind of context about the actual tool itself. And some of the other things that we've noticed and some frustrations around improvement initiatives and sustaining them is the lack of sustainability with the improvement evaporation effect. And so really what that is saying is that the improvement evaporation can occur when someone, for example, leaves an agency or switches jobs, and we see that. And the actual change is dependent on an individual. And so the work that you've done kind of just fades away because there isn't that person there to keep that ball rolling. And the islands of improvement effect is that lack of spread. So something is happening really great over in one area of an organization or of a sector, but nobody else really knows about it. And we can fight these spread risks by sharing information. So things like communities of practice, or oftentimes some of the project teams that we have been coaching have actually taken their work to conferences and shared their learning through that avenue, webinars such as this are also good opportunities to share work. So just keeping that in mind and sharing your work is really important to sustaining improvement. Next slide, please. So sustainability, as a definition, is about holding the gains of a QI project over that long term, as I've said. It seems that several or all of the following organizational properties are important to sustaining improvement. So supportive management structure, so not necessarily supportive individuals. So, you know, having a great boss or somebody in an executive sponsor position who's a great cheerleader for your improvement, but also that there's structure within the management system that allows for continued improvement and change. Structures to error-proof your change. So the model for improvement, PDSA cycles that you're going to be testing your change ideas on. Having a robust system in place to do that would be important. Transparent feedback systems, so making sure that there's an avenue to share back some of those challenges that you're experiencing and being honest about what it is the system is telling you. Shared sense of the system to be improved. So making sure that everybody kind of understands what it is that you're experiencing and that everybody is behind that. Culture of improvement and a deeply engaged staff. So that it's not just one pocket of individuals who are leading improvement initiatives, that it is, as Alex identified earlier, that a part of everybody's work. And that they identify with the initiatives. A formal capacity building program. So that is, you know, it can be in the form of education. So taking things like the ideas, foundations to QI learning, attending professional development. It can also be with part of your formal employee feedback and however you do that in your organization and professional development. And so some of those things it's really good to take note of and pay attention to as an organization as you're moving through your initiatives. And the next slide, please. So standardization is usually part of sustainability of a change idea or a change improvement or an improvement initiative, my apologies. So the standardization of your system or your process, documentation of any policies, procedures, and protocols and guidelines, measurement and review of the change becomes part of routine practice. So it's not always, it's not just something you measure up into March 31st of 2020. It's actually something that you continue to measure past the actual improvement project timelines, and then of course the training and education. And just a notation and a thought around this is that when you're looking at standardization and the documentation and training, those are usually instituted after you have seen sustained improvement in the measurement, usually over more than 6 to 7 data points. You would want to see that sustained over the long period of time before you start to standardize systems or processes. Just a thought there. The next slide, please. And this is just a diagram that some of you have likely seen before that was developed by Chris Hayes from IHI at St. Mike's Hospital. And this is just an infographic that will that demonstrates that if you have a change idea that increases your workload and has a very little perceived value, it's less likely to be adopted in the long term. So always designing your change ideas that will actually hopefully reduce your workload for staff and that the perceived value is high and that they can get behind it. That's where you want to design your change ideas for, and that relates directly to sustainability of a change or a system process. And so looking at the next slide, we're talking about the NHS Sustainability Guide, and I'm just going to walk you through some of the factors related to that over the next several slides. And this, again, was developed by the National Health Service, NHS, and it's used to predict the likelihood of sustainability of your improvement project. It is a guide. It's not, you can use it just to kind of have a conversation with your organization, with your project team, with stakeholders of your project. And it can be very useful in identifying those things that you need to pay attention to early on in order to sustain your project. And so on the next slide, it shows how the three different modules link together. And we're going to be going through each of them just in a minute, but one of them is staff, one of them is process, and one of them is the organization. So looking at all of those factors for QI success and sustainability at both the organizational and at the team level, you can actually get a sustainability plan in place and have that success long term. So the first factor that we'll look at is process. And this is related to the benefits, credibility, adaptability, and effectiveness of that process or of that system. And so looking at the benefits, and of course, every improvement initiative, we always like to have the client-centered focus. And if you have that client-centered focus, that's wonderful. But we also, to add benefit to that, is there other benefits to it that will actually that go beyond helping the individuals that we serve? So for example, does the change reduce waste or avoid duplication or redundancies? A little bit of a lean lens on that. Credibility of the benefits. Are the benefits to the patients, staff, and the organization visible? Do the staff believe in those benefits? Can the staff clearly describe a full range of benefits? And I think that's a really great one, because if you can actually get all staff to describe the range of benefits of the improvement initiative and that they believe and can stand behind it, I think you're going to have great success. Is there evidence that this type of change has been achieved elsewhere? So knowing that this has been successful in other organizations or other environments can be helpful. Adaptability of the improved process. Can the new process overcome internal pressures? Right now we have a lot of external pressures that we need to pay attention to as well. Does the change continue to meet ongoing needs effectively? Does the change rely on a specific individual or a group to keep it going? And again, making sure that the system or the change can continue to happen regardless of who's sitting at the helm. Can it keep going when those things are removed? Effectiveness of the system to monitor the progress. Does the change require a special monitoring system? We know that we have a lot of data that's required to be reported, but oftentimes we have to do workarounds when it comes to quality improvement initiatives and collecting that important data that's associated to that specific issue that we're trying to solve. Is there a feedback system to reinforce the benefits and the progress? Are mechanisms in place to continue to monitor and progress beyond the life of a project? And are the results of the change communicated at all levels of the organization? So just some things to think about when you're trying to design your new process, when you're walking through your new change ideas. To have this lens applied to it would be really helpful. The second factor is staff. And of course, this is a really important one when we're looking at sustainability, because you need the people to do the work and to sustain the improvement. So getting staff involved from the very beginning can really be helpful. So having them included in the innovation, the design, and the implementation of the change would really increase your the sustainability scores. Have they used their ideas to inform the change? So making sure that you include them in the designing piece and having those ideas inform the change. Is there training and development infrastructure to identify gaps in skills and knowledge, and are staff educated and trained to take the change forward? Something to consider if you're adopting a new assessment tool, for example. Staff behaviors towards sustaining the change. So are the staff encouraged and able to express their ideas regularly throughout the change process? Do staff think that the change is a better way of doing things? Are the staff empowered to run those small scale tests of change based on those ideas that they designed? From the senior leadership perspective, having that engagement and support from them can be really helpful. So are those leaders trusted, respected, believable? Are they involved in the initiative? Do they understand it and promote it? Are they taking personal responsibility and breaking down those barriers? So being able to have somebody in that role who has that impact can be really helpful. Clinical leadership engagement and support. Again, are they trusted, respected, and believable? Are they involved and understand, and do they promote the initiative? And do they take personal responsibility to the change? So those are some factors to consider as you move through your project related to staff. And so the third one is around organization. And this factor is although it only has two kind of subtitles here, it is a really important one, and from the perspective of alignment to the strategic aim and culture of the organization. So asking yourself some questions related to the organization can help you put those things in place for success. So are the goals of the change clear and shared? Clear contribution to the overall strategic aim. Improvement is important to the organization and the leadership. And has the organization successfully sustained improvement in the past? And so having answers to those questions can kind of give you a sense of where you're going to land from a sustainability perspective. And then some points around infrastructure. Are the staff trained and competent in the new way of working? Are there enough facilities and equipment to support the new process? Are there new requirements built into the job descriptions? Oftentimes we make changes to how we do things, but not necessarily are those built into those job descriptions. And so as people are onboarded, they may not know what those specific steps are and can be problematic. Are there policies and procedures supporting the new way of working? And is there a communication system in place? So those are the three factors related to the sustainability tool. And the other piece that we're just going to highlight as well is building on measurement on an ongoing basis past the life of the actual improvement project itself, moving into that sustain phase. So is there an ongoing monitoring system to measure the future performance of the improvement? So when you're working through an improvement project, you're looking at your outcome measures on a monthly basis, and then you're looking at your process measures on a weekly basis to see the uptake. And an improvement project it varies in length, but usually in and around the 12-month mark. So during that time, you're measuring fairly frequently. Past the end date of your improvement project, you're then going to look at sustainability and see if you are able to sustain those gains for a period of time. So for 6 months, for example, maybe or even maybe 8 to 12 months later, are you able to sustain that data? And is there a standardized way of communicating those results? Reinforcing that the change is important to practice so that it doesn't just fizzle off and become something that we did a year ago and we no longer continue to do. So building in those ongoing monitoring systems can be really helpful in sustaining your improvement efforts. In the next slide, we're just going to highlight some of those things around hardwiring your changes. And we've talked about policies and procedures. But before you do that, you want to make sure that changes that you've tested have been tested in a variety of conditions. So if you've tested it in a day shift, for example, have you also tested it in an afternoon, evening shift, or even an overnight shift, to see if there were any pieces that you needed to make changes to in order to adapt to those specific environments. And then majority of staff have tested the changes. So not just a pocket of individuals or employees that have tested the change, but you've actually tested it across all or the majority of the staff. Improvements in key processes and outcomes are clearly evident on run charts or control charts. So again, making sure that you have a good measurement system in place. All staff on all shifts have been trained, and thought given around training for new and temporary staff. So again, that onboarding piece, making sure that you have those pieces in place to instruct new employees. And then necessary supplies and equipment and the forms are all in place. And when we're looking at having forms in place, we also want to make sure that we remove all the old forms. And then a small set of measures has been identified to monitor performance over time, and individuals have been assigned responsibility for monitoring performance. So not only are you asking for those measures, but you're actually assigning the responsibility and accountability to that, to somebody. And then you want that person who's accountable to then respond back and communicate those results to the senior leaders or whomever is asking for that information. If the performance declines, so if you're starting to see data that's telling you that it's starting to move in a downward direction, that there is some accountability that has been identified to address that situation. And that standard work has been developed and documented. So if we're looking at the next slide, the NHS Sustainability Guide, and why is it that we're suggesting that you use this tool? There's a list here of some of the reasons why we feel it is a great tool to use. There are other areas that you want to focus on as well, but the NHS Sustainability tool is a great way to keep your project focused, practical. There's also, it's a very visual way to look at your sustainability scores. It's inclusive, so it hears from everybody. And of course, when you're completing these tools, we want you to have a discussion. It's not about necessarily doing a checkbox and handing it in. It is about having a conversation about how everybody is feeling about the question and potential answers and scores, and have everybody's input on that. It's doable. There's suggestions for simplification. It gives you some ideas around how you can improve, what areas you might want to focus on. It's balanced, so it looks at different approaches. It's adaptable to different audiences. It connects to the strategic plan and fits in with the organization as a whole. And it's practical, real-life examples. So I'm just going to pause there. I know that we're able to monitor the chat box. I'm just going to pause to see if there's any questions. And then Alex and I will see if we can answer them for you at this juncture. There's a lot of information that came through on those few slides. I recognize that, but have you had any thoughts around sustainability? Did anything jump out for you around your own potential improvement initiative and some things that you may want to consider moving forward in your organization?
Thank you, Laura. And we did get one comment from the audience, and I'm just going to read it out here so I make sure that I'm doing it justice. And it says, one of the most critical things to consider in sustainability is a process for selecting, training, and coaching new staff. Another is the need to monitor fidelity over time to ensure that what's being delivered remains true to the intent original. The links here to implementation science principles, for example, NIRN, are obvious. And I think that's a really excellent point. And as Laura sort of spoke to some of the criteria or some of the things that really lend well to ensuring sustainability. Definitely talking about that ongoing training and orientation of new staff is huge. And I do like the point about monitoring fidelity as opposed to kind of just like that spray and pray principle where we just figure we'll throw it out there and hopefully something sticks to the wall. Implementation science is a really good method for hardwiring changes and kind of that widespread implementation when a new way of doing things is adopted and you really want to make sure that it sticks and is embedded into ongoing processes and programs. And on that note, just to kind of iterate the difference between quality improvement and implementation science is quality improvement is kind of the, again, systematic work that you would do once a problem has been identified, which helps kind of make an articulation of a problem statement, determine some root causes that are contributing to that overall problem, and then coming up with a way to measure change and successes over time. And once that measurement piece is sorted out and the root cause analysis has been done, it's when we would start considering change ideas. With the quality improvement methodology, we really advocate for rapid cycles of testing and of change. But once something through that PDSA cycle has been determined to be like a really good fit and something that's really going to bring about a lot of change and something that wants to be embedded and hardwired, that would definitely be a possible place that you would want to try out some implementation science principles, as mentioned by that one commenter. So thank you for that. We have a question around, do you have suggestions on what kind of monitoring systems can be put in place that yield the best results with the least disruption, cost, effort? I don't know, Laura, do you want to take a stab at that one?
So do you have suggestions? So I'm just going to read the question again. So do you have suggestions on what kind of monitoring systems can be put in place that yield the best results? I think the answer to that question would land with the specific change idea or the change initiative and what systems you currently have in place. They don't need to be, so for the actual life of the project work, it's going to be, like I said before, the process measures are going to be looking at those change ideas associated and those process measures associated with those change ideas on a pretty quick turnaround. You're going to be monitoring that on a weekly basis. And so those are not necessarily, quote unquote, hardwired into your monitoring systems. But as you start to look at the longevity of your projects and sustaining, so the only thing that I can think of from an example is something like the OCAN and net needs. And you might be wanting to look at a specific domain related to something that you found in your initiative that you were monitoring throughout, most likely related to your outcome measure, or the OPOC questions. You may have one that you would use as an identifier for a specific problem or an issue. So those types of like monitoring systems related to data. But that's, I guess, as you're moving through your change idea, keeping your eye on and noticing and being curious about what you currently have related to monitoring systems. You may need to create something for the longevity. So we talk about some organizations talking to their vendors for their client management systems to hardwire that monitoring piece into their system. And we all know that sometimes that there's an added cost to that. And so if this is something that has been done somewhere else and another organization using the same client management system, sometimes you can actually band together and share the cost or potentially remove the cost because it becomes a high need for the sector. I'm not sure if that answers the question. If you could just let me know, or perhaps if you need more clarity, I'm happy to do that as well.
And just, I have kind of a concrete example I can provide, and it really speaks to whatever the change is going to be. The monitoring system is something that you kind of want to embed into work that's already being done. So for instance, when I worked with an organization that switched to a new client record system, we were realizing that there was a bit of a gap between those people that had used previous systems and those people that were brand new and being onboarded. So we actually took the orientation checklist for all new employees, which already had an embedded training plan, and made sure that we included a thorough orientation to the new client record system and had certain kind of subtasks that would relate to their job specifically. So if they were frontline, it would be things around how to make a case note or a progress note, how to create appointments, etc. So between the new employee and their supervisor, they would go through that orientation checklist. And once the employee felt competent in the new system, they were able to check off that orientation, again, something that was already being done with new employees, and we were able to monitor the fidelity that way. Great questions, though.
Yeah, great questions.
Yes, so so we got a comment back that says it makes sense to work with those who can sort of embed it and make sure that tracking is at low cost or via minor tweaks and things that already exist. So for sure. Sustainability does not need to be complicated, and actually the more complicated it gets, the harder it is to hardwire, right? So try and keep it simple and effective. And since we've got those questions answered, please feel free to keep putting your questions in throughout. We will definitely have a couple more opportunities to address those. So if you have anything that pops into your mind, feel free to drop it in the chat or the question box. And in the sake of time, we'll move on to the next sort of interactive, well, more kind of demonstrative, I'll say, part of the webinar. So as Laura mentioned earlier, this is the third of a series of 3 webinars that have looked at different types of assessment tools that can be used by organizations that are undertaking quality improvement initiatives. So again, this one kind of focusing on QI success and sustainability. We've also talked about QI readiness assessment, which is based on a tool that's been adapted from a couple of other various tools that have been used in the sector around what sort of factors really lend to success of starting quality improvement projects. So things around QI or quality improvement culture within the organization and team readiness, etc. And previously, we've also talked about doing sort of a data assessment, but up until now, we didn't have a formal assessment. It was really done informally and verbally. So organizations would say, you know what, we don't have a data governance policy. Do you have any suggestions? And we would kind of do it on an ad hoc basis. So that really created challenges around lending to the success of our quality improvement initiatives, because really data is such a foundational piece of it that we needed to really start identifying those data challenges early on. So we've also created a data assessment that you can learn more about in one of our previous webinars. So the answer to kind of all of these different things, how do I set up for QI success right from the get-go? Like, are we ready as an organization? How do we assess our data culture and our data quality, as well as how do we know that we're going to be all set for sustainability? So we as E-QIP has sort of pulled from tools that exist in the sector and have come up with this integrated data and QI sustainability assessment tool, which is in the attachment section under the handouts and it's currently living in an Excel spreadsheet. So we're going to take an opportunity over the next few minutes here to go through that more in depth. So it's really helped to analyze and identify those blind spots as well as strengths, and to help us kind of create a roadmap from assessment to action. So Laura went through the sort of 3 different components of the sustainability assessment earlier. So we see here that we've got the 4 questions that speak to the process piece of the sustainability. So talking about benefits and credibility of the changes, the adaptability of the process, and the effectiveness of the system to monitor that progress. Then we have the staff aspect. So that was broken down in the NHS sustainability tool into 3 sort of particular questions. And those are behavior towards sustaining the change, ensuring their senior leadership engagement support, as well as clinical leadership. And you can see for each question, there's 5 options. The top being not sure about the choices, the second being, strongly disagree, and then kind of a narrative around what that might look like for your organization in particular. The third being, disagree, and then agree and strongly agree, each having sort of, again, that narrative that describes what that might look like at your organization. And for this particular tool, you may find that you don't answer the narrative specifically. You may find that there's a bit of an overlap between the 2, in which case you would pick the one that is most accurate. And the third sort of component being the organization piece, so the fit with the organization's structure or strategic aim and culture, as well as infrastructure for sustainability. So it's 10 questions. We're asking a lot for 10 questions, but it's definitely a really helpful tool to sort of parse those things out early on. It gives our team a sense of kind of where they're at, identifies against areas of strength as well as areas that can be improved upon, and can be used as a pre and a post measure to kind of see how far we've come. So we do recommend for the sustainability that this particular tool be done kind of towards the part of the project where, some of the root causes have been identified already and you're looking to start coming up or either coming up or testing those change ideas. So you can start kind of talking as a team like, okay, now that we're looking at trying these changes, are we in a position that once we come up with some successful changes, we'll be able to hardwire those? And I'll flip it over to the Excel spreadsheet itself. So if you've been able to attend some of our previous webinars, you'll have seen this Excel spreadsheet. So it's all kind of been pre-created in terms of the tabs and the instructions. So on the first tab, the guidelines page here, we've got sort of an explanation of the assessment, as well as the summary, action, and supplementary questions. It does describe that during the assessment that you would want to complete this as a team in order to kind of get everybody's perspective and be able to weigh in and say, you know what, this is my perception of where we're at. What do you think we're at? Do we feel that this is an area of strength or an area of opportunity? And sort of getting everybody's opinion and being able to complete it as a team. And then it also kind of describes when you would probably want to complete these. So again, data and QI assessments can be filled out pre and post project duration, while the sustainability tool should probably fill out once the diagnostics have been finalized and then after the change ideas have been completed. So if I go through to the next tab here, the pre-assessment, you can see I've actually gone ahead and started filling this one out in particular. So if I scroll over, we've got all 3 tools in the pre-assessment tab. So the data culture, QI assessment, and the sustainability assessment. So this particular team that we're demonstrating here did the data culture tool about 6 or 7 months ago in the first week of April, and then completed the QI assessment the next week in April. And now it's been about 6 months, we're saying, hypothetically, and they have come up with their diagnostics to address some of their root causes, and now they're looking at what some of their change ideas may be. So they want to do their sustainability assessment to make sure that those changes that they're testing are going to be something that they can hardwire. So you can see they've got their scores kind of already calculated in here. If I flip to the summary page, It shows kind of some of the areas of strength as well as some of the areas of opportunity, the areas of strength. So we've got our 12 kind of green lights here. So these were areas that were strong on both the data and the QI side. And then the yellow ones would be kind of some of those areas that we wanted to maybe do some improvements in as we go. So you see here that we've got in our pre-assessment for those first two tools that no action was needed on about 2/3 of the items. We had some optional as well as one kind of urgent activity. So that's what it looks like for the first tools being done. We'll go back to the pre-assessment tab again, because this is the first time the sustainability assessment is going to be filled out by this group. We're going to say, okay, so we're November 7 today. Oh wait, I almost got the year wrong there. So fill that in, make sure we have the completion date. We're going to say that our team feels that we can demonstrate that the change has one or two benefits beyond helping patients. That's how we're feeling about it. Although in terms of credibility, let's say that the benefits of change have not yet been widely communicated to people. Adaptability should be pretty okay. Then I'll just go through and kind of flick these pretty quickly here. Effectiveness of the system, actually that's a strength of ours, I'll say. We've had staff involved. Staff have had pretty good behavior towards sustaining the change. We've had a high level of senior leadership. Clinical leadership's been spot on. Maybe it doesn't really fit too well with our strategic aims and culture, but it's something we wanted to do anyways. And our infrastructure maybe needs a bit more improvement. So again, as a team, you would go through each of these options and again, kind of figure out which one fits your current scenario the best. Again, it would be your kind of realistic current state, not your desired future state. We're talking about things that are concrete in the moment, not like, oh, well, when we have a new system to collect information, it should reflect kind of the reality currently. So here now we can see that our sustainability section has started populating. We've got our green areas of strength, and then we've got our 4 sort of areas where we can do some improvement. So again, we've got kind of our little graph here of, you know what, we probably want to take these 4 and bring them up to the keep it and well done section. So how might we try to accomplish that? Well, we can go to our action tab, the purple one here, and look at sort of, you know what, some of those factors that we may have scored in and a potential action plan for each. So if I look at my summary and I say, you know what, credibility of benefits scored pretty low, I think that's an area we can improve upon. What does it recommend over in the action section? And I'll just kind of scroll over. So this is in the center of the screen. So we've got the credibility of benefits question. We've got this section that kind of provides some suggestions. So it says, provide evidence that this type of change has been achieved elsewhere and share this with staff and clients and organizations. So you want to provide enough information to allow all staff to learn about the benefits of the change. So again, that's kind of some suggested actions that can be done. So if I go to the very last tab in our tool, I can scroll over to the sustainability section. Again, we wanted to focus on, I'll highlight it here, the credibility of the benefits because it scored low when we assessed as a team. So we're going to see, yes, we need some action there. So the action items, and again, we can take right from here some of the suggestions that are in the action tab and say, okay, you know what, by December, we know that one of our partnering organizations in a different county has done something very similar as to what we're proposing. So let's invite a staff from there that was involved in the change, and we can do a lunch and learn. So how about December, we're going to invite Sue from XYZ Mental Health Services to provide a lunch and learn about the change initiative. So she can speak to some of those benefits that they've experienced and hopefully add some credibility. We can also say, you know what, we think that the Center of Excellence just released a best practices paper about that. So let's get the paper and we can share it with the team members. So we'll say December, share best practice paper with QI team members, and then those folks can kind of share that information with staff to, again, sort of add credibility, because we're hoping to align those changes with those best practices, and that should kind of, again, add to the credibility of the changes we're making and hopefully get that buy-in. So we're going to say that this is pretty high priority. We can get it done pretty quick. It shouldn't be too bad. We're going to say that the team lead is responsible. We kind of indicated by the end of December that we want to have these things done. The 2-month follow-up would be, we'll say, the end of January, and then we'll go create the next steps from there. And hopefully we don't need to go to the 6-month follow-up date, because this should be sorted out by then anyways. So that kind of takes us all from, you know, an item that we identified in the pre-assessment as needing some help, maybe definitely not an area of strength, so something that we wanted to work on. It showed up again in our summary tool. And then we went to our action tab, looked at some of the areas that we could potentially use as an organization, and then put our plan into place. So again, this isn't just for the sustainability tool. You can kind of house your work plan for each of the areas, whether it be data, QI assessment, or sustainability, kind of all in one place. And then, you know what, once we've kind of rolled things out, that's when we want to go back to our post-assessment. Once we've kind of put a cherry on top of the project, we've reached our aim, we want to wrap things up, and then we can go through and do a post-assessment and compare and contrast between the two. That's the tool sort of in a nutshell. Again, we kind of mentioned already when we wanted to complete the assessment. So we talked about having those conversations. It's never too early to start talking about sustainability and start keeping it in mind, talking about where those areas of strengths are and how we can help leverage those to maximize the potential for sustainability and improvement. And then again, just before the change ideas are tested, because those change ideas ultimately, if beneficial, are the things we're going to really want to hardwire into our new way of doing things and embed into everyday business. And then we talked about the action plan. So the then what, now that we've identified that we may need some help in these areas, making sure that we can operationalize it, put a work plan in place, and start taking steps towards improvement. We can, again, also prioritize at that point, do our action plan. We definitely suggest that if you can, come up with some SMART plan goals, or some SMART goals, making sure that they're specific, measurable, attainable, realistic, and time limited. So we definitely had firm dates in the example we used around having things done by the end of December. Those were kind of one-ofs. We didn't necessarily have to say by how much necessarily, but our measurement was, has it been done, yes or no? And then we can go from there. And then just kind of reflecting back on the integrated tool in a nutshell. So it's really about considering sort of our knowledge, attitude, and practices around exploring the different aspects of the organization when it comes to quality improvement work, really kind of wanting, again, to solicit those conversations at the team level, making sure that everybody has their say, because in my experience, people at the front line may have a different overall kind of consideration around how things are going versus those at the management level. And this is really just an opportunity to have those conversations, get everybody on the same page, and start working together towards that common goal. Sort of helps highlight not only the blind spots, but also identifies the advantages that should be kept. So those areas of strength, again, great for prioritizing and moving on to next steps, as well as providing an opportunity to really assess this in a methodical manner that we have measurement associated to, so you can see the improvements as changes were made. It really helps lend to an overall culture of quality improvement in data, and sort of really gets everybody speaking the same language. And we actually have time, I'm trying to look at our clock here, to take some more questions. I realized that we had to go through the tool really quickly, so if there's anything you'd like to see again, we can go back through the tabs, or we can talk about the graphs a little bit more, or if you have any questions about sustainability practices, hardwiring changes, or any other sort of burning questions that we can take a couple of minutes to answer. Again, just kind of pop them into the question box. I'll invite Laura to chime in if I've forgotten anything.
That's great. I think there is a couple questions in the chat box there. One is, so is the expectation that the sustainability tool be completed for each QI project? And yes, it is. It's really important to look at, because you're not looking at sustainability capability of the organization as a whole, but you're looking at your each specific project. So what are those pieces that are specific to that project that you will need to hardwire in? And so your next question that you had is related to, once you've got 10 completed QI projects, how does an organization continue to monitor and revisit sustainability at a more global level? And I think what you're getting to there is really, if you've done 10 QI projects and have taken the time to look at each project sustainability, the ability for the improvement initiative to be sustained, then I would suspect that those pieces that are related to the organization as a whole in that tool would have been addressed at that global level. And then the more specific pieces around the process and the staff would then be monitored and revisited from the sustainability lens for each of your initiatives. I don't know if that answers your question, but I think you can adapt and the tool to your needs. But I think you do always need to keep your thumb on the pulse of the organization and its ability to sustain improvement. So I'm hoping that that helps. I don't know, Alex, was there anything else that you would add to that?
I think you made an excellent point, Laura, around the organizational factors probably won't change too much unless you've experienced some significant changes at the organizational level. But you definitely want to consider that each quality improvement project should probably have a life of its own. And depending on the focus of that particular quality improvement project, you may have different team members that are working on it. You may have different other partners that are involved. And every time the team composition changes, it's a good idea to have conversations about sustainability, especially if you are kind of bringing in other partners to kind of get that fulsome picture. And again, things like credibility of the changes can vary from project to project. So I think it's a good idea to kind of go through that learning at like a team meeting. It doesn't have to be necessarily like as in-depth, but again, kind of if there are areas where you're concerned about bringing those to the forefront and just having those kind of dialogues at the onset. Hopefully that answers the question. We do have a couple people saying that they've got to step out. That's okay. Have a wonderful day.
Yeah, and I guess if there aren't any other questions, we'll move on just to the last few slides, which will be just reviewing some of those additional resources that you might be interested in. And yes, thank you, Joy. We do see that it is you So really appreciate the interaction and the questions that you've been bringing forward to us today. So thank you for that. And yes, just thinking that both organizations and practices do change and drift over time from a capacity perspective. Yeah, there may be a need to review and revise sustainability efforts over time. Yes, very wise. Thank you, Joy. So moving on to those resource slides, I just wanted to take you through just a few of those pieces that you might be able to use in support of your initiatives as you move through the Quality Improvement Initiative. We do have our E-QIP Quick QI webinar series. And when we say quick, it is not an hour. They are 20 minutes to 34 minutes, I think, in length. So much shorter. And those higher level thoughts and concepts. They don't go into the nitty gritty of each of the different types of tools that we use in QI, but give you a good overview and maybe a refresher if you're heading in that direction with your own initiatives. They might be worthwhile taking a look at. And the links are there, as well as the slide decks for each of those webinars. And we also have our general webinar series that can be found on our YouTube channel. And those are linked within each of those little arrows. We're talking, we have some really great kind of our favorites. Some of them, the one that I like to reference quite frequently is the Enhancing Joy in Work with the wonderful Chris Hayes, who joined us for that webinar. So if you're looking at your QI project and thinking, you know, I want to make sure that we're not adding to staff workload and that we are incorporating the idea of joy in the workplace, might be a great webinar to take a look at. We also have some of our report back presentations from cohorts 2 and cohort 3 of E-QIP. If you are looking at engaging client and family members, we have a series on that, or one webinar on that. And then we also have the experience-based co-design webinar, which are really great webinars to take a look at. Then, of course, we have the companion webinars to the sustainability webinar today, which is the data culture and the QI readiness assessment webinars. And would encourage you, if you haven't had the opportunity to see the first two, that you do take a look at those as well. And then the Ideas Foundations of Quality Improvement, that is another offering that we have. And it's a one-day workshop that goes through those key quality improvement concepts, gives you some foundational knowledge around the methods of QI and the practical tools. And then we also have our E-QIP newsletter, which you can join there on the link and kind of keeps you up to date with what's going on in the E-QIP world. And then the next slide is our community of practice. So it allows you to stay connected to this community where you can get access to QI training resources, learning about other QI projects that might be relevant to the work that you're doing. And again, looking at it from a sustainability perspective and those islands of improvement, working on eliminating those, that's a great way to do it, is through this community of practice. And connecting with others in the community, mental health and addiction sector. So you can go to the link there on the bottom of the page and click join group. And then when you find and search for our E-QIP COP under the groups page, then just sign up. We would love to see you there, and I'd love to have a conversation with you there. And we're also just highlighting that if you are transitioning to the OCAN 3.0, just contact the folks at CCIM if you have any questions, because they have their aggregated reports are now accessible to those organizations who are using the IAR as well. So just click on the link there, and that will send you along to learn more about those different changes and what's happening there. And this is our contact information. So Alex and I are at the bottom, and our email addresses are there. And then we also have Debbie Bang, who is the Director of Quality Improvement at AMHO, and also Ashley and Amy, who are the Program Managers, both at AMHO and at CMHA Ontario. So feel free to reach out to any of us at any point in time. We are always happy to help. And that will close out our webinar for today. Please feel free to reach out with any questions, or if you have any thoughts that you would like to share with us. Thank you so much for following along with us today, and we look forward to talking with you in the near future. Have a great day. Thank you all.
Thanks, and take care.